You're welcome again. Happy Sunday. This is your friend. We want to talk about CS, that's Operation for Giving Birth. And in some part of the world, some people believe that it's for weak women or is a taboo. But there are some reasons why they carry out what we call CS. You understand? And under that, we have what we call absolute indications. Number one under there is placenta previa. When we're talking about placenta previa, it's just the abnormal positioning of the placenta. For example, the placenta stays, covers or occludes the vagina, preventing occluding the place that the baby is supposed to come out from. Then number two is placenta abruptio, when the placenta just detach and removes from the normal place that it's supposed to be. And at times it might be uterine rupture, when the whole uterus rupture or part of the uterus is ruptured. There is nothing you can't ask a woman that has ruptured uterus to start pushing because you want the baby to come out. And at times it might be due to fetal distress, when the baby when there is a prolonged labor, there is distress for the fetus, the baby inside, and they have tried all manners of things to do vaginal delivery and it has failed. They might likely resort to Ceasarian operation. It might be umbilical cord prolapse, when the cord just detaches from the normal place. It might be due to multiple gestation, and when we're talking about multiple, it might be twins, it might be triplet, it might be quadruplet, and at times they might be accompanied with complications. It may be to the mother or to the baby. They might decide to do that. And if there's previous surgery to the uterus, like removal of fibroids, myomectomy, they can, of course, advise the woman to go through CS. And of course, under that, we have active herpes, genital herpes infection. There's something we call herpes simplex. It's just like an advanced form of sexually transmitted infection. And of course, they can be advised to do it. Then we have the relative indications. Number one, under maybe you have had CS before, you might be asked to do it again. Maybe you have gone through a failed induction of labor. They have tried all manner of things and they have tried to induce you. It's still not working. Is one of the things that can cause that. Then if you have prolonged labor, we mean any labor period that is higher than 12 hours, you might be advised to do that. And of course, if we have what we call microsomia, and what we call about microsomia is the big babies that most of them usually weighs more than the normal weight of a fetus. And then if it is it might be breech presentation, when the baby maybe is supposed to come, with the head, and the baby is coming with the hand or the leg or something. It might be as a result of that. And of course, apart from the breech presentation, it might be multiple fetal malposition, where you have like 2-3 babies and they are not properly positioned and you don't want to risk it. And it might be uterine anomalies, where the uterus is not the type of uterus that is then the normal type of uterus. They might decide to do CS or previous pelvic surgery like cesarean itself. Maybe you have had it before, or previous hysterectomy, part of the uterus has been removed, cesarean hysterectomy. It is possible for them to advise you to do that. Then if you are obese and you have BMI that is greater than 40, you might be advised on that. Then gestational diabetes, if the mother is having diabetes as a result of those pregnancy and the babies are now bigger than what is normal, it is possible for you to have, be advised on to have Ceasarian operation. Then of course under that we have maternal request. You are not, maybe you just requested for it as a woman. Then what we call it elective cesarean section. There is no problem, you don't have any complication, you don't have any indication, you just feel, please, this is what I want. So that is number one. Number two, fear of vaginal delivery. You don't want to have to go through the stress. You just prefer that you might be allowed to do it. Previous traumatic delivery, maybe you have had a baby, or the last delivery was not palatable, and you just want to be safe out there, and you prefer, or some is just personal preference. You understand? They just, this is what I just want. You understand? That's what we call elective. Then we have under another indication is fetal indication. If the fetus, if there is growth restriction and the baby is not having space, to grow, they might advise you on that. If there's fetal anomalies, like the baby is in utero, they have heart defect or anything, they might, just advise you to do that. Non-reassuring, when you are listening to the heart rate as a midwife and you see that, you can just advise them appropriately or talk to the doctor. Or if there's fetal distress, the baby is already tired after a prolonged labor, it is possible for the doctor to say, okay, let's go there, right? Then we have obstetric indication. When we're talking about this, it might be pre-eclampsia with severe features. When we are pregnant, we are not supposed to have high blood pressure. But when you now have high blood pressure in pregnancy, it can be a problem. So if the doctor has seen something like that, they might say, and the features, the symptoms are so severe and serious, they might advise you, well, let's go do this. Then if you have uterine problem, or there is something we call cervical stenosis, the cervix that the head of the baby is supposed to, pull. That's the place that the midwife used to tell you 1 centimeter, 2 centimeter, maybe it's stenos. There's no way that the cervix can expand. There is stenos, cover like occluded. They can ask you to do that. And if they are trying to use forceps or vacuum extraction for the baby to come out and it's not working, you can be advised to do that. And we have various other indication. And under that, we have HIV positive mother with high viral load. Most of the time we advise them so that to protect the babies. We ask the mother if their viral load is still high, that they should do CS to keep the baby alive. Then 2, active tuberculosis is one of the indication. Previous pelvic radiation. Most of these things are just there, but we should not see women going through CS as being lazy or trying to waste our money is a taboo. Note, of course, that these indications are not exhaustive. All this one we have done, and the decision for cesarean section should be made on a case-by-case basis, considering individual. We are not going to say, okay, this happens to no. We are going to consider individual circumstances and medical history, their age, and a whole lot of things. If you have learned 1 or 2 things in this video, join me in the next video. I'm your friend, Nurse Felicia. Kindly subscribe to my YouTube channel.